Assalamu alaikum everyone. Hope you all doing well. Today my topic is general and oral dental anatomy of dental nomenclature. One oral and dental anatomy terminologies, definition and description of the various anatomical features of a tooth and its supporting structure including the following. Dental structure, supporting structure. Dental structure में आप फर्दर आ जाते हैं anatomical crowns, cranial crown, anatomical roots, clinical roots, enamel, dentin, cementum, cervical line, dentino-enamel junctions, pulp cavities and pulp. Consist of the following entities: pulp canal, pulp chambers, pulp horns. Anatomical crown, the position of the tooth which is covered by enamel. Clinical crowns, that portion of the tooth which is visible in the mouth. The clinical crown may or may not correspond to the enamel crown. Depend on the level of the tooth investing soft tissues and so may also include a portion of the anatomical roots. As can be seen from the descriptions, the clinical crown may be an ever-changing entity throughout life, while the anatomical crown is a constant entity. Anatomical root, the portion of the tooth which is covered cementum. Clinical root, the portion of the tooth which is not visible in the mouth. Again, the clinical root is our changing entity and may or may not correspond to the anatomical roots. Fifth, enamel, the hard mineralized tissues which cover in the dentin of the anatomical crowns of a tooth. It is the hardest living body tissues, but it's brittle, especially when not supported by sound underlying dentin. 6. Dentin, the hard tissue which forms the main body of the surrounds the pulp cavity and is covered by the enamel in the anatomical crown, and by the cementum in the anatomical root. The dentin constitutes the bulk or majorities of the total tooth tissues, but because of its internal location, is not directly visible in a normal tooth. And the 7 is cementum, the layer of hard bone-like tissue which covers the dentin of the anatomical roots of a tooth. Cervical line, the identifiable line around the external surround of a tooth where the enamel and cementum meet. It is also called the cemento-enamel junctions, or the cervical line separates the anatomical crowns, the anatomical roots, and is constant entity. It is location in the general area of the tooth spoken of as the next cervix. Dentino-enamel junction, the internal line of the meeting of the dentin and enamel in the anatomical crowns of a tooth. Pulp, the living soft tissue which occupies the pulp cavity of the vital tooth. It contains the tooth nutrient supply in the form of blood vessel as well as the nerve supply. 11 is the pulp cavity, the internal cavity of a tooth which contains the pulp. It consists of the following entities: pulp canal, pulp chambers, pulp horn. Pulp canal, that portion of the pulp cavities which is located in the root of the tooth and may also be called the root canal. Pulp chambers, the enlarged portion of the pulp cavity which is found mostly in the anatomical crowns of the tooth. Pulp horns, the usually point incisals or occlusal elongations of the pulp chambers which often correspond to the cusps or loops of the supporting structure. First, alveolar process, the entry bony entity which surrounds and supporting all the teeth in each jaw membrane. Second, alveolus, plural alveoli, the bony socket or portion of the alveolar process into which an individual tooth is set. Third, periodontal ligaments membrane, the fibers attach of the tooth cementum to the alveolar bone. Fourth, gingiva, plural gingivae, the gum or the fibrous tissue enclosed by the mucous membrane that cover in the alveolar process and surrounds the neck of the teeth. डायग्राम में फर्स्ट लेवल क्या alveolar crest fibers, the extreme rims of the bone nearest to the crowns of the teeth. Second, horizontal fibers found near the alveolar crest running at the right angle to the long axis of the tooth. Third, interradicular fibers, specifically found between the roots of the multi-rooted teeth such as premolar and molar. The third is oblique fibers, a part of the periodontal ligaments. Direction the insert into the bone coronal. Apical fibers, part of the periodontal ligaments. Found cementum around the apex of the roots to the bone. And the next diagram show our gum tissues and bone. Gum tissues, pink color, soft tissue, surrounded, protect the teeth. Third diagram, first level क्या है coronal tooth. The direction toward the crown of the tooth. Gingiva, around the base of your teeth. Root, located below the gum and is covered lined by cementum, a hard tissue. Periodontal ligaments attached to the alveolar bone. Alveolar bone, supporting and the boning structures of the jaw. Anatomy of a tooth. Occlusal surface. Occlusal surface, the twin surface of the back teeth, molar and premolar, grinding and breaking down food during mastication. Enamel. Enamel, hard protecting outer layer of teeth. Dentin, hard bone-like tissue, main body of the teeth, lying beneath enamel crown and cementum root, and is the harder than bone but softer than enamel. Pulp, soft tissue inside a tooth. Gingiva, part of the gum around the base of teeth. Root canal, treatment to repair and save a badly damaged or infected tooth instead of removing its crown. Tooth-shaped cap that cover a damaged tooth or dental implant. Cervix stacks, the visible part of the tooth meets the roots, specifically where the enamel outer layer of the crowns meets the cementum. Outer layer of the tooth at the cemento-enamel junction. Radix, roots toward the back and the tongue side, root in a mandibular lower molar tooth. 8. Dental nomenclature. It is imperative that the same terms are consistently used for the various anatomical area of the teeth so that the dental health team can converse in a precise but the simple manner. The following then is a portion of the common language of dentistry. A. Interior teeth. The teeth in either arch which are toward the front of the mouth. In both the deciders and permanent dentitions, the interior teeth include the incisors and canines, a total of 3 per quadrants and 12 in all. B. Posterior teeth. The teeth in either arch which are toward the back of the mouth. In the decidus dentition, these include the 2 molar in each quadrant. Are a total of 8 teeth. The permanent dentations, these include the both premolar and molar, or a total of 20 teeth. Tooth surface, interior. All interior teeth exhibit 4 surface and 1 edge on their crowns. They are named as follow: mesial, pedestal, C. Labial, lingual, incisal edge. Mesial, the surface toward the midline distal, the surface away from the midline. Labial,
the outside surface which is toward the lips lingual, the inside surface which is toward the tongue. In the maxillary arch, the lingual surface is sometimes called the palatal surface. Incisional edge, the biting edge. Tooth surface. Second, posterior. All posterior teeth exhibit 5 surfaces on their crowns: A, nasal, distal, and lingual. These surfaces may be defined like the corresponding surface of interior teeth. B, buccal. The outside surface which is toward the cheek and corresponds to the labial surface of the interior teeth. The term facial surface may be used for either the labial surface of interior teeth or the buccal surfaces of posterior teeth. Occlusal, the chewing surface. Tooth surface. 3. Root. Root surfaces are named exactly like the surface of crowns, except there is no incisional edge or occlusal surface. The terminations or the tip of the roots is termed the apex. Fourth is proximal. This term refers to any surface between two teeth. So proximal surface by definitions are normally only mesial or distal surface. D. Line angle. The line or angle formed by the junctions of two crown surfaces, and its name is derived by combining the name of those two surfaces. One naming line angle and points angles. The name of the surface are combined by dropping the L from the end of the first surface and constituting adult. D. Line angle. There are thus 8 line angles on each tooth, and they are listed as follows. First, line angle of interior teeth: mesiolabial, labo-incisional, mesio-lingual, linguo-incisional, disto-labial, mesio-incisional, disto-lingual, disto-incisional. Second, line angle of posterior teeth: mesio-buccal, bucco-occlusal, mesio-lingual, linguo-occlusal, disto-buccal, disto-occlusal, disto-lingual, mesio-occlusal. Third, of crowns and roots. First, crown. The crown surface of teeth are divided into artificial thirds, both horizontally and vertically. These thirds are named by their location according to the surface which is being viewed. For example, the mesial crown surface of an interior tooth exhibit labial, middle, and lingual third when divided vertically. When divided horizontally, this same mesial crown surface has incisional, middle, and cervical thirds. Second, root. The root from any aspect is divided into horizontal third only, which are termed cervical, middle, and apical third. The term cervical denotes toward the cervix or neck of the tooth, or in other words, toward the cervical line. The cervical thirds of the roots and crowns are thus adjacent to each other and are separated by cervical line. Apical, toward the roots of the teeth, middle, upper and lower jaw. Cervical, irregular margin that constitute the boundary between the enamel covering the crowns and cementums covering the roots. Cervical. Distal, the tooth surface that is away from the midline of the face. Middle, upper and lower jaws. Nasal, surface after tooth that is closed
closest to the midline of the dental arch on the front of the mouth. Cervical, irregular margin that constitute the boundary between the enamel covering the crowns and cementum covering the root. Middle, uppers and lowers jaw. Incision. The cutting edge of interior teeth, especially the incisors. Occlusal, the surface of the teeth that come into the contact during between biting and swallowing, especially that the top surface, molars and premolar. Middle, upper and lower jaw. Cervical, irregular margin that constitute the boundary between the enamel covering the bone, crowns and cementums covering the root. Buccal, outer surface that face the cheek. Middle, upper and lower jaws. Lingual, the side closest to the tongue, opposite that, the cheeks or lip sides. Lingual, the side closest to the tongue, opposite the cheeks, lip sides. Middle, upper and lower jaws. Label, the area that is visible when the lips are closed and the teeth in their natural resting position. Third up, crowns and root. Crown surface from the geometric configurations of all crown surface of teeth except incisal and occlusals can be placed in one of three general categories: triangular, trapezoidal, or rhomboidal. Facial and lingual surface from the facial and lingual aspects. All prominent teeth in the mouth can be roughly described as trapezoidal. The incisal occlusal sides from the base of the trapezoid, while the cervical represent the shorter parallel side. Arrangement of these trapezoidal shapes crown side by side, and the dental arch creates interproximal space between the teeth as well as one contact area between the each pair of adjacent teeth. Since the shorter parallel side of the trapezoid is at the cervical, there is a adequate space available for bony support around the roots of each tooth. From the surface of teeth, trapezoidal most common and protects the periodontum in the several ways and is shown in the diagrams. From the surface of teeth, crown surface from mesial and distal surface. First, interior teeth as viewed from the proximal surface. The crowns of permanent interior teeth exhibit a triangular shape with the base of triangle at the cervical and the apex at the incision. This shape readily fits into the prescribed functions of the interior teeth, since the apex at the incisal function is the verge entering, pitting, and the incising food material, while the wider cervical base provides the necessary strength for the crown's front. Second, maxillary posterior teeth. The crowns of permanent maxillary posterior teeth have proximal surface which are roughly trapezoidal in shapes, which the base at the cervical and buccal and lingual side constricting toward the occlusal. The journal shape also provides the verge from which aids in the distribution of focus during mastications and facilitates the self-cleaning process of the teeth. From the surface of teeth, crown surface from mesial and distal surface. Third, mandibular posterior teeth.
From the proximal apex, prominent mandibular posterior teeth are roughly rhomboidal, with the crowns inclined toward the lingual. These forms and insulations allow for proper interlocking of the mandibular and maxillary posterior teeth during mastications.
From a surface of teeth, triangular. Gaps or shaped triangular in shape that appear between the teeth near the gum line. Trapezoidal, most common and protect the periodontum in several ways. Rhomboidal shape like parallelogram with no right angles, side of unequal length.